All right, I had to get back to my screen where I could do that. And let me turn on my, you can see me, it'll be so exciting here. All right, hello everybody. We are gonna go ahead and get started. I want to take a minute just to welcome you all to this New to Medicare series where we will learn all about the A, B, C's, and D's of Medicare. So I'm Julie Smith, and I'm a Family and Consumer Science agent for K-State Wildcat District Extension. And I just started in January of this year. So I'm really looking forward to learning all of these things right along with you so that hopefully in the future I'll be able to assist folks as they sign up for Medicare. But I wanted to introduce to you those that will be presenting tonight. Joy Miller and Tara Solomon Smith are fellow Family and Consumer Science Extension agents. Joy is in the Southwind District. Tara is in the Wildcat District. And they are both certified SHIC counselors. Melanie Smith, who hopefully will be able to get on here by the time it's her turn, is the SHIC coordinator for our area, and she works for the Southeast Kansas Area Agency on Aging. So you might be asking, as we talk about this, what is SHIC? And there we go. SHIC stands for Senior Health Insurance Counseling for Kansas. It is a free program that offers older Kansans the opportunity to talk with trained community volunteers and get answers to your questions about Medicare and your other insurance needs. SHIC provides you with the resources that will help you as you navigate the Medicare maze, as they call it. SHIC does offer free one-on-one counseling sessions for those who are new to Medicare, those considering changes during the yearly open enrollment period, and to caregivers that are seeking resources to help a loved one. So we are going to go over what you will learn tonight. Before we do that, I'm going to launch a poll, and it's going to come up on your screen and ask you, what is your current Medicare status? So if you could take a moment to answer that as we go over the learning objectives. Ooh. Can everyone see? Tara, Joy, can you guys see that?
Yes, I can.
Okay, great. Looks like we've got some answers coming in too. So we will end that and share the results in just a moment. But our objectives for tonight are, first of all, what is Medicare? What is the eligibility to be involved in the Medicare program? Go over how to enroll, some of the costs, and really get into the specifics of all of the parts of Medicare. And tonight we'll learn about parts A and B, and also the Part D prescription plans. Also, there are some penalties, and we want to go over those and how to avoid those, and then share with you some timely resources that will help you as you get signed up for Medicare. So I'm going to go ahead. It looks like we've got 9 of 13 that have voted. So I'm going to go ahead and end the polling and share with you the results. Can you see the results too?
Yes, ma'am.
All right. Well, it looks like we've got folks that are joining Medicare within the next 12 months, and then some that are already eligible for Medicare but have insurance through their employer or their spouse, and then one that's also currently on Medicare but still working. So thank you for sharing that. With that, I'm going to turn this over to Joy to start the rest of our evening.
All right, thank you, Julie. We're going to start with just what is Medicare. So Medicare was enacted in 1965 as Title 18 of the Social Security Act, which created a comprehensive health insurance program for older Americans. So I think the number is about 55 million people in America are on Medicare, and it is the largest insurance program available for people. So it is a federal health insurance program, and Medicare, it was meant to pay for some medical costs, but not all. And Medicare is not the same as Medicaid, although some people may be eligible for Medicare and Medicaid. So, Julie, next slide. All right, so who is eligible for Medicare? So the first thing is you either must be a U.S. citizen or be a permanent legal resident, and that's somebody with a green card and who has lived in the U.S. for 5 consecutive years before applying. So then the next thing is you must be 65 in general. So when you turn 65, no matter who you are eligible for Medicare. Some people may be eligible for Medicare if they're under 65 because of a Social Security disability. Others that may qualify have end-stage renal disease, and those with Lou Gehrig's disease are also eligible. All right, next slide, please. All right, so signing up for Medicare, those who are automatically signed up for Medicare are people who are already receiving their Social Security benefit checks or benefits. So if you went ahead and sometimes you just say early retirement, took it at 62, 63, you will already be enrolled when you turn 65 for that. So with automatic enrollment, you will receive your card 3 months prior to your 65th birthday or prior to your 25th month of disability benefits. If you have Lou Gehrig's disease, that will begin the month your Social Security benefits do begin. So just back up, Medicare is the same whether you receive Social Security benefits or if you are receiving Railroad Retirement Board benefits. So, all right, next slide. So if you are receiving those benefits before you are 65, this card, we call it the red, white, and blue card, will be coming to you. And if you are not already signed up, you will be receiving this card when you sign up. But this is just an example of what you will be receiving in the mail. So, next slide, please. So if you are not taking your Social Security benefits or railroad benefits, you will have to actively go sign up for Medicare. So again, to do this, it's about when you're 64 years old and 9 months out. And then again, there's some special circumstances with end-stage renal disease about signing up for Medicare. So again, if you are not receiving Social Security benefits, you will have to initiate the process to sign up for Medicare if that's what you want to do. Next slide, please. So how to sign up. So for Social Security, you can make an appointment to go to your local office. So in the Southwind District or Bourbon County area, Nevada, Missouri is one of the offices that's really close. And I know there's one in Independence, Kansas, which might be closer to those in the Wildcat District. And there may be some others that are optimal offices for you to locate. You can also call a 1-800 number, and you can also sign up online at the socialsecurity.gov website, which is ssa.gov for short. So Social Security is only going to sign you up for Medicare Parts A and B, and they will not advise you on any other part of Medicare pieces. If you have railroad benefits, contact your local railroad board office, or again, they have a number of 877-772-5772. So again, if you have railroad benefits, you just sign up for those benefits through a different agency or board. Okay, next slide. So tonight we're really just talking or focusing on those who are turning 65. Those of you who may be working and continue health insurance, you might have some delay of your initial enrollment, or if you took out some of the parts, you may have some special enrollment. So you may have some more questions for us outside of this presentation, and that's all right. So for most people, they'll have their initial enrollment will begin, let's just say, when they're 65. So that is the 3 months before they turn 65, the month of your birthday or the 25th month of your disability, and 3 months after your qualifying month. So there is one exception to this rule, is if your birthday falls on the 1st, you will start a whole month earlier. So for instance, my mother's birthday happens to be October 1, and so her month, her quote, now birthday month would be September. So September, she used to get to start a month earlier, which can be a good thing. All right, next slide, please. So this is just an example of how this would work. If you sign up the 3 months before your birthday, it will begin the 1st of the month of your birthday. If you sign up the month of your birthday, it will be effective on the 1st day in the next month. So Medicare and these programs do not start mid-month. It will always begin on the 1st day of the following month. If you sign up the 1st month after, so this would be technically like the 5th month of all of this, your effective date will not be till for another 2 months. So that's the one thing to be cautious of, is after your birthday month, there's an extra delay of 1 or 2 months, up to 3 months of when that will be effective, even though you're still in the qualifying enrollment period time. If you totally miss your enrollment period when you qualify, you have to sign up during the general enrollment period, which is between January 1 and March 31st of every year, but your insurance will not be effective until July 1. So there's some cautionary information there for you. All right, next page, or next slide. Okay, so again, we're specifically talking about Medicare Parts A and B. So when we think about Medicare, we have parts and then we have plans. And so Medicare, we call this original Medicare, has 2 parts, the A and B. Part A is considered hospital insurance. And so it tends to cover like inpatient care in hospitals, skilled nursing facility care, hospice care, and home health care. So one word of caution when we think about skilled nursing facility care is often we might start off in the hospital receiving skilled care, which allows more time to heal and get stronger so we can be independent in our homes. And sometimes people will be transferred to a nursing home for that. And so that can become a misunderstanding, is when it cannot go home and they no longer qualify for skilled care, and now it becomes custodial care. Medicare will not cover custodial care, and there isn't a way to reactivate it or to get back on skilled usually at that time. So just to be cautionary of that piece. Medicare Part B is considered our medical insurance. And so this helps cover services from doctors and other healthcare providers. So that's physical therapists, occupational therapists, respiratory treatments, some things like that. Also covers outpatient care, some home health care, durable medical equipment, and many preventative services. What Medicare A and B does not cover is dental work, eye exams, dentures, cosmetic surgery, acupuncture, hearing aids, or even routine foot care. So just so you know, there's some things that Medicare's A and B do not cover. All right, next slide, please. All right, so costs. Medicare Part A premium, that means what you'll pay every month to have this plan, is usually $0 for most people. Most people have paid enough what's called FICA tax into the system. And so if you have 40 quarters or have been married and your spouse qualifies with 40 quarters, it will be $0 for you. Sometimes people have not worked enough quarters to receive that, and so they may be paying for part of their Medicare Part A, which would be $252 per month if they've worked 30 to 39 quarters. And if they have worked less than 30 quarters, it'll be $458 per month. So far in my experience, I've never come across anybody who's had to pay any of their Part A premiums. So in my experience for this 5 or 6 years, I have not come across that. So that may be a good thing. All right, next slide, please. Medicare Part B, the standard premium for everyone is $144.60. So Medicare Part B is based on your income from what you filed for income taxes 2 years prior to signing up. So if you are a single person and you make $87,000 or less, or if you are married filing jointly, $174,000 or less, your standard premium is $144.60. Anybody who's making above those numbers will have an adjustment, and it's called Income-Related Monthly Adjustment Amount. In short, we call our IRMA, but your Part B premiums may differ and can range from $202.24, or maybe it's 40 cents, sorry, there's an extra number in there, to $491.60. And that is per person, no matter what your marital status is. So if you did well in life financially, you may get to pay a little extra to cover those things. So there's just some cautionaries when you're doing income tax, especially if you're selling big things, land, property. Those may be some triggers that creep you up into that adjusted amount. So be cautionary of that if you're making big sales that will count as income. All right, next page, please. All right, so deductibles, co-pays, and insurance. So there's the amount we have to pay each month to have the plan, and then there is the costs you are responsible for when and if you use the Medicare insurance. So for Part A, we have a deductible. This is not an annual deductible, it's considered a benefit period, but for this year it's $1,408. So a benefit period is you've entered the hospital and it is effective until you've had so many consecutive days outside of the hospital. And I don't remember exactly how many, it may be 60 days out before that benefit period would restart. But that deductible covers the first 60 days of being in the hospital. After that 60th day, you'll have some co-pays after that. So days 61 through 90, you'll have a $352 a day copay. If you reach day 91, it's $704 per day. And after the 150th day, you'll pay 100% of that. And again, skilled nursing, if you are the first 20 days, is 100% covered, but days 21 through 100, it will cost you $176 per day. And after day 100, you are responsible for 100%. So that's a little more complicated. Part B is somewhat simpler. It is an annual deductible, meaning you will only pay it once. That annual deductible for 2020 is $198. After that, you have a 20% co-insurance. So whatever Medicare agrees to pay, you are responsible for 20% of that. And then any of the preventative benefits, which are similar to if you have like Blue Cross Blue Shield or United Healthcare, those kind of, I might consider them the employer benefit insurance or marketplace. Those preventative benefits, just like those insurances, are $0. They don't want any barrier for you to get these services. So with Part B, a deductible, a co-insurance of 20%, but there is no maximum out-of-pocket that there's no end to that 20%. It just goes on and on and on. So often our other insurances have a maximum amount you'll pay per year. But with Medicare on Part B, there is not. So just again, 20% doesn't sound bad, but there's no bottom to that number that you may have to pay. So our next slide is preventative benefits, and I believe Melanie was able to join us, and she's going to pick up from here.
Hi everyone, I'm Melanie Smith, and Joy kind of touched on preventative benefits, and I'm going to explain and go into a little more detail on that. Basically, a definition of preventative services is healthcare to prevent illness or detect illness at an early stage when treatment is likely to work best. And with Medicare Part B, preventative services, preventative benefits cover several different categories, different visits, different kinds of shots, and different kind of preventative screenings, as well as counseling. And I'll go in a little bit and walk you through a summary of those different categories. Next slide, thank you. First of all, when you start Medicare and you've just become eligible, you've just gotten your B started and you are eligible, during your first year of having B, you are entitled to what's called a Welcome to Medicare visit. And the doctor will review your medical and social history and kind of also review some preventive benefits that would be good for you to pursue. So within that first year, you would have what's called a Welcome to Medicare visit. Now, after your first year of B, those visits are then called wellness visits. And just to be sure to know, this isn't a physical exam, but it's again an assessment to just see maybe what various kind of tests you might need to do to just keep yourself at the best of health. And so there might be some tests that aren't preventative, that aren't free, but then there would also be some that you are allowed under Medicare that you could have that are free. And I'll get into that more. Yes, and here that is the preventative shots. Under Medicare and the preventive benefits, you can have flu shots every year, hepatitis B shots, and pneumococcal shots, help with that. Next slide, please. And here's the screenings that the preventive screenings that are allowed. There's actually 21 different screenings, and this is kind of an overview. They have a bone mass or bone density screening you can do, of course, screening mammograms, several different cancer screenings. I'll list those. They have cervical, lung, prostate, and also the colonoscopy, colorectal screenings. They do more than just a colonoscopy. There's several different colorectal screenings that they allow you. Then also cardiovascular, prostate, hepatitis, HIV, diabetes, depression, and glaucoma. So it covers quite a big area. And also in that is they do what's called screening and cessation counseling for people that have trouble with alcohol, tobacco. They offer cessation counseling for that. Also, there is for diabetes, nutritional counseling, and even if you have weight issues, they offer screenings to help you work out a regimen to hopefully lose weight. Next screen. And this is kind of just a really brief summary of it, but you can also find the list of preventive screenings and services on in your Medicare 2020 Medicare and You Handbook on pages 30 through 49. These services that are preventative, they have a blue apple on the side by that service, so you know those are covered. Or you can also go to medicare.gov and under click the blue tab Medicare covers and then go to preventative services. Something that's good to know, Medicare I know for sure that, like, say, the bone density screening, that's only allowed and covered, like, I think every 2 years, every 5 years. So not everything is allowed every year. Sometimes there's a time limit, time frame that you can do it again. Others, I think colonoscopies, if you're healthy, you know, you're just supposed to have those every 5 years. So they're not always a free service every year. It just depends on which one of the benefits you're taking. They have kind of time frames on that. Next screen. I'm going to talk a little bit about coronavirus, COVID-19, and just what Medicare is helping with on that. First of all, Medicare does cover the lab tests for COVID-19. So if you were wanting to be tested to see if you have the virus, you would not have any cost in doing that. No out-of-pocket costs for that. Next slide. It does help with medically necessary hospitalizations in relationship to coronavirus. That doesn't mean that you don't have deductibles, like Joy was going through different deductibles and co-pays, but it does help cover things that are related to that if you had to be hospitalized or be under quarantine. Okay, and then also, there is no vaccine for COVID-19 at this time, which we know, but if it was to become available, Medicare would cover with that, help with that cost. Also, your Medicare Advantage plan, if you have one of those, you do have access to some benefits, same benefits, but I would definitely call the plan and make sure to be sure what they do cover. Medicare Advantage plans kind of vary on their coverage. It's not always identical to your Medicare A and B. And then the next slide, please. I was going to visit a little bit about telehealth. Medicare has temporarily expanded its coverage of telehealth services because of this crisis. And so they will pay for that if you decide to go with a telehealth checkup, which that's pretty much the case. A lot of doctors are going that route right now. And just because they don't want people exposed to the virus. And so what they've done, they expanded their current telehealth coverage services to help you have access to more places. Excuse me. So just to have available checkups, you can do virtual check-ins or online patient portals. And Medicare, if you have original Medicare, there'll be no cost to you for that. If you have a plan that the supplemental plan asks you to pay co-pays, things like that, you would have to pick up those services. But for the majority of it, it is going to be low cost, which that's great, especially when people are so concerned in these times. And this has been such a pandemic. And that's all I have on that. Thank you.
Hello again, everyone. This is Tara Solomon Smith, one of your Wildcat Extension District agents. I'm going to start my video for a little bit, see how far our width gets. I am going to talk to us about the D in the alphabet, which is prescription drug coverage, or also known as Part D. Next slide, please. It is optional. It's run by private insurance companies. What you need to sign up for it, you would need Part A, B, or both. Certain companies have planned service areas, so you need to live in a service area for a plan. You can purchase regardless of your health status. So they're not going to ask you those pre-existing health questions like they might with other health insurance. You can only have one Part D or prescription drug plan at a time, and cost will vary. Next slide, please. So if you're new to Medicare, your initial enrollment period is much like signing up for Medicare, the 7 months around your 65th birthday. So that includes the month of your birthday and then the 3 months prior and the 3 months after. There's also an open enrollment period every year from October 15th through December 7th. This is a good time to look at your plan anyway. You can change plans every year with no penalty, no questions asked. The effective date would be the following January. And then there's also some special enrollment period. So if there's a life change, or maybe you stayed on your employer's insurance and then you officially retire, then there's a period of 2 months after that life-changing event. Next slide, please. So some things to consider, the 3 C's: cost, coverage, and convenience. Not all Part D plans are the same. So this year, Kansas has 28 prescription drug plans. They do have separate monthly premiums, so they'll be separate from your other either supplemental, or if that's the way you go, it'll be another monthly cost. And this year, those range from $13.20 to $74.70 per month. Some of them have yearly deductibles, which you must pay before the plan pays. However, not all drugs are subject to the deductible. So sometimes if you're just looking at premium and deductibles, sometimes that can be deceiving. That's why you definitely want to do a personalized search based on your medications that you're currently on. Most Part D plans require you to pay some share of those medicines, either a copay or a flat rate for that medicine, or a coinsurance or a percentage for that medicine. And the amounts will vary based on your plan, the medicines you're on, and the pharmacy that you utilize. So you've probably all heard of the donut hole, or that coverage gap. The good news is that has slowly decreased. It's still there. Some people, but not everybody, fall into that coverage gap. If you do, the good news is that now the plan pays 75% of your medicines and you pay 25%, which is a lot less than what it once was. But again, not everybody will fall into that. The coverage gap begins after you and your drug plan have spent a certain amount for your covered medicines. So right now that's $4,020. And that's combined the amount of your medicines plus your deductible. And so then you come out of that once you reach another certain amount. So depending on when and if you even fall into that, you may or may not come out of it. So once you've spent a total of almost $5,000 out of pocket, then you come out of that gap and go into catastrophic, which means it ensures you only pay a small coinsurance or copayment. So the next C is coverage. Most plans have a formulary or a list of drugs that the plan covers. Plans have rules about how they cover various drugs. So again, it does matter, and it is good to look at every year since your medicines change and plans adjust a little bit. And then finally, convenience. Drug plans work with some, but not necessarily all pharmacies in the area. The plans may charge you a lower cost if you use certain pharmacies, but you may just need to crunch the numbers. Maybe it's not as convenient to drive 20 miles to Walmart rather than utilizing your local pharmacy. So it does matter. Some plans do have mail order as well. This year I noticed that they didn't save you as much money as sometimes. But the best place to compare plans is online at Medicare.gov, or utilizing one of your senior health insurance counselors. Next slide, please. So do you need Part D? Enrollment is optional. You need to ask, do you have credible drug coverage already? If yes, you can keep that drug coverage with no penalty. If not, and you're not on any medicine, so you may not feel like you need that drug plan, and you decide to join later, there will be a penalty, which Melanie will cover a little bit later. Plans that we know that are just as good as Medicare Part D is TRICARE for Life, VA drug coverage, and then IHS, or Indian Health Services. If you have other drug coverage, such as a job or a retiree plan, find out if it is as good as Part D. Your plan must send you information each fall that tells you whether your plan's drug coverage is adequate compared to Part D. Your plan also must notify you if your coverage ends or if changes happen. And then in that case, you can then join Part D within 63 days. It's important to save all documentation that you receive about your drug coverage or insurance coverage from your employer or retiree plan. And it's important to read everything carefully, check with HR department, check with your contacts before you join Part D and before you make a decision, because sometimes if you join, it can affect that insurance. Next slide, please. So again, not all drug plan is the same, and it does vary based on your needs. So it's important to shop every year. This is one of the documents that I emailed out prior to our program this evening. These are the plans for 2020. But again, you'd want to check and really plug in your medicines to see what might be best for you. And that's it for my portion.
Okay, I'm going to discuss Part A penalty. And it's like what Joy said, not many people have to pay Part A. So the only time you would have a penalty is if you are having, not if you have to pay Part A, but if there's a reason you don't get A as soon as you should, then there's a chance that you would have to pay a penalty. And how that penalty is figured is it's 10% increase for twice the number of full 12-month periods that you could have been signed up, but you were not enrolled in Medicare Part A. So like say you were out for 2 years, they're gonna double that, what your premium would be. So it can really escalate and be very high. So the best thing is to join up when you are eligible and not to join at a later time. Next slide. Part B penalty is 10% premium for each 12-month period that had passed and you did not enroll when you were eligible for that. And they say there is no cap on the penalty amount. That, for example, beneficiaries could be responsible for paying anywhere from 10% for 1 year delay or 250% if you were like 25 years late in signing up. It'll just keep accumulating the percentage that you have to pay as many years as you're out. Next slide. On the Part D penalty, how that works is if you did not have credible drug coverage and did not take out a Part D plan, you'll be penalized 1% of the national base premium for each month you're eligible, but you didn't enroll in a Part D. So every year what that is they look at all of the Medicare Part D premiums that are offered, and then they get the average cost of what a monthly penalty or monthly premium cost, and then they charge you 1% of that times how many months you were not enrolled. And then you don't only just pay that penalty amount, but you also have to pay, if you sign up for a D plan, you pay what that monthly premium is, including the penalty. So your monthly costs that you're going to have to pay can be really high when you add both the penalty and what your Part D plan penalty is, or Part D plan premium, excuse me, is. So best thing is to just really be advised on when you should enroll so that you don't get into trouble and not be covered when you should be. There is, next slide, there is on Medicare.gov, there is a premium calculator that you can go in and just kind of get an idea of what your premium. This is without penalty, but I was told too that it also kind of can help calculate, I think, if you have a penalty and what to expect. So that's the website for that. And you can check information on penalties there and just your regular premium, what it would be. And also, they do say on this website, though, that you have to be 65 to even enter your information or for it to calculate for you. If you're younger than that, it won't work. One thing to realize is when it comes to premiums and your penalties, sometimes if you do qualify for extra help, it will reduce the penalties and your premiums cost. It all is based on what your income is and what category of extra help you fall under. So sometimes there is a little bit of mercy, a little bit of help with those penalties, but for the most part, people will be stuck with those, and you just want to do everything you can to enroll in the right time frame so you won't be stuck with the penalty and have extra costs. Next slide. We want to tell you about SHIC counselors in the area. If you're needing help, and everybody does need help, often through the Medicare process, we ask you to call the Southeast Kansas Area Agency on Aging, the 1-620-431-2980. And I would visit with you and help you connect to a SHIC counselor in your area. And this is something I would recommend for everybody. Everybody's Medicare situation is unique to themselves. And so yours won't be the same as Mr. Smith down the street. You all have different criteria, all different scenarios, and that's why it's best to really, once you think you know the right path you're going on, or if you feel like you're pretty good at knowing how you should go forward with your Medicare and enrolling, I just advise visit with a counselor. They could just confirm that you're on the right path or even give you some more suggestions or help. So you would be set up right for everything to work the best for you. And just like Tara and Joy and myself, we're the SHIC counselors. We also have a need for volunteers, people in the community that just help us with the counseling and help direct people. And so we want to encourage you, if that's something you think you'd be interested in, just guiding people and informing them about Medicare and Medicare insurance and supplements. That too, you would just contact the Southeast Kansas Area Agency on Aging office, and I would get you set up to be a volunteer. It does take some training. We have to do background checks. There's some online training as well as you have to do on in-person training, but it is a very rewarding part-time hobby or just thing to be a part of, volunteer to be a part of, and it's really great when you can help people in the process. And then I think we have a slide on resources next, and this is just different resources we communicated here and discussed here in this presentation, and wanted you to have those links, but also in the handouts for this presentation, we have those links on that too. The handout that's called New to Medicare, it's a checklist. That handout has those listed for you that you can access that way. And I think Tara's going to close with some more information for you.
Yes, thank you. We do like to always improve our programs. So we do have an online survey. I just put the link, the direct link in the chat. If you happen to have an iPhone, you can open up your camera and hover it over the QR code on the screen, and a link will come up and you can click on that and it'll go directly to the survey. So we appreciate you filling this out for us, telling us what we can do, telling us what you learned, telling us what we can do to improve upon this with this short survey. We do hope to see you on Thursday. We're going to get into the depths of supplementing and helping fill those gaps where Medicare A and B doesn't completely pay for all of our medical needs. So we'll go into more detail about that, as well as some extra help options for individuals and more resources. So again, that link is in the chat box as well. You can copy that link and put it into a browser. And I think, Julie, I may have you go ahead and go to the next slide. And this talks about, this is just another way for you to get some relevant, concise, sound information from Extension. There is a link to sign up for emails, or you can get text messages, and you don't have to have a smartphone to receive those. You can just text that message to the number 81010. And that's all I have. We appreciate you being on, and Julie's going to conclude us.
Sure. I don't see any questions in the chat. I'm going to give you guys a minute. If anybody that's on does have a specific question, please feel free to type that in the chat. I had one just as I'm learning right along with you guys. And I don't know who can answer it, but based on the penalties that you talk about, it sounds like anyone turning 65 should sign up. Is there any scenario where you wouldn't?
Yes, some people who are continuing employment may have employer insurance that will continue, and so it may cause double coverage or very expensive coverage in the end, having your employer insurance plus Medicare. It's not necessarily cut and dry. If your employer is a small employer, ladies, correct me if I'm wrong, I don't remember if it's 30 or 50 employees and under, you must take out Medicare A and B, and that is primary. And so that would impose a penalty if you're with a smaller employer. And then their insurance can become secondary. If you are with a large employment group, their insurance would be primary, and you don't have to take out Medicare A and B then, but some people do choose to, and Medicare would be secondary. I always advise people, if you're going to continue working and you have employer insurance, or your spouse has, your spouse is on your employer insurance, to double check with your human resource department. Their Tri-Valley here in Bourbon County, their Part D drug plan is not considered creditable through their employer insurance. And so when somebody turns 65, they go ahead and sign up for Part A, which is premium free, so that they can get a Part D drug plan and avoid penalty for not having a creditable drug plan. Why their drug plan is not creditable, I am not for sure. So I just always advise people to double check. Do they have to sign up for Medicare A and B, or is it optional at that time? So it's not always cut and dry for somebody with employer insurance whether to sign up for A and B. And again, that's always a good reason to contact us to find out what you need to find out, what questions you might need to ask, so that you have a clear, defined answer for your situation.
Thank you, guys. I think that's the point that I am taking with it is if we have resources such as certified CHIC counselors that can answer these questions, use them. Does anybody else have any questions? We do have one. It says, I missed the window for signing up. I have insurance through my school district. When can I sign up for Part A?
So between January 1 and March 31st will be the open enrollment period for Medicare Part A and B. So for now, so if you just want to sign up for A, you'll have to wait till next January. So here's that little if, when you decide to stop your current insurance, that will create a special enrollment for you to sign up for Medicare. So leaving your employer insurance creates a different type of window to sign up for Medicare A and B.
Gotcha. Are there any other questions, guys? If you're not comfortable typing in the chat and would like to ask by unmuting yourself, feel free to do that as well. All right. Well, thank you all for being here, and hope you're able to take something with you. And we are looking forward to joining right back here on Thursday night. Will we use the same link, guys?
Yes, it will be the same link that you should have received after you registered, but feel free to email me if you have issues or can't locate that link on Thursday.
Great. Well, have a good night, everyone.
Thank you, ladies.
Thank you.
Bye, everybody.